Mr. Stanfield, thank you so much for coming in today. We really appreciate you taking the time to meet with us. As we previously talked about on the phone, the purpose of the meeting today is to answer any questions that you might have about what happened with your nephrostomy tube and to get you some answers about what we've been able to unearth from our review of this event. This is Dr. Simpson. He is the Quality Improvement Director for Radiology, and he's going to talk you through some of the things that we found.
Okay.
Nice to meet you. As Catherine said, I'm a radiologist here at BIDMC. I'm also the physician director for the quality and safety work in radiology, including in the area where you have the tubes exchanged.
Okay.
I'm the person who led the investigation into what happened. I really appreciate the chance to meet with you and to bring you up to date on what we found.
Okay, it's nice to meet you. I'm really interested to know what you found out.
Sure. So as part of the review, we looked into your medical record with a focus on the notes for the tube change in December and the tube change in January, where the block tube was changed over. We also interviewed the 2 nurses and the doctor who took care of you in interventional radiology in December. Unfortunately, one person we were not able to interview was the interventional radiology tech who was there. This person's role typically is to assist the nurse and the doctor during procedures. He had left BIDMC in late December to relocate and was no longer available for us to be able to speak with.
Okay. I do remember who those people are. A lot of them on the team that you mentioned, because I've done this every month for a few years now.
Sure. So let's go through what we found. What we determined was when you were here in January, after becoming sick and noticing less urine coming out of the tubes at the tube change, that there had been a small plastic cap, which is similar to what may be used at the end of IV tubing, was discovered on the left nephrostomy bag, in between where the catheter is and where the drainage tubes go to the nephrostomy bag. I think you had said that the team had mentioned this to you at the time that it happened, but I wanted to make sure that you knew exactly what we had found, and we believe that the cap was placed there during the tube change in December. In looking back, we know that this cap is not part of the supplies normally used for this procedure in IR. It's not something that comes on the tubes in the package and needs to be removed, nor is it something that is used on certain other types of tube replacements. The 2 nurses and the physician were interviewed. They did not remember applying a cap of any kind to the tube. And as I said, the IR tech is no longer at BIDMC, so we really don't know what he might know about the cap, if anything. So in the end, it remains an unanswered question about when, why, who put the cap there. We unfortunately just don't know. But we've taken a number of steps to address what happened regardless of how it got there. And I can tell you a bit more about that, but for the moment I wanted to pause here to see if you have any questions for me.
Well, as you said, it is definitely frustrating that you don't really have an answer to this question, because my whole concern is that this not happen to someone else or to me ever again. And I guess we'll never know how it happened, and that's definitely frustrating. And also, I can't believe you can't find this guy, this IR tech person.
Yeah.
It's frustrating.
It is frustrating. We always want to know as much as we can about how did this happen, and he unfortunately is just not able to be contacted. We've tried a number of ways, but Dr. Simpson will elucidate this a little more. We do want to make sure that whatever we put in place will prevent this, no matter how it happened or who did it.
Yeah, and I also can sort of appreciate your frustration with this. We want those answers as much as you do, and even without that, I think we know that we can put in place some process to make sure that this hopefully never happens again. The error that we made is one that we deeply, deeply regret, and I want to apologize to you both on behalf of radiology and BIDMC for what you've been through as a result.
Well, I appreciate the apology. I do. But, as I keep saying, this was really an awful experience. I mean, really bad for me and my wife. And I just don't ever want anyone to have to go through this again. And so, I come here every month, and I really do like the people here, even after all this. But honestly, I think I'm always going to be worried about whether someone else is screwing up, and it's going to cause me some serious infection that's going to keep me hospitalized for a bunch of days like this happened. And I don't know. I guess I'm not fully satisfied is what I'm trying to say.
Mm-hmm. I can't possibly understand how you feel about it, but what I can promise you is that we will put in place processes to hopefully ensure this doesn't happen again to you or anybody else. We have started by sharing this case and what we've learned with the staff who do this procedure. We've done education sessions on the correct steps for the procedure with all types of clinicians who are involved in it. And we've highlighting that the tube should not be capped at all. But education is not enough, right? So we've also made a change to the form that's used at the end of the procedure that prompts the clinicians, including the nurse, to confirm that the tubes are flushing properly all the way through. So this is a new requirement and part of sort of a checklist form. And that makes sure that the flushing is to be well documented before the case ends. So if there had been in place that step in your procedure where we had to confirm that it would have been flushed before we ended the procedure, this certainly would not have happened.
All right, well, I guess we'll see how it goes. My next appointment isn't for a while, so I guess I'll have some time to really think about all this.
Yeah, and in the meantime, I wanted to make sure that you knew that all the bills were waived from that hospital stay resulting from this, as they should be. You might have seen this in the final report for the DPH letter that was sent you, but we just want you to know that those are all taken care of. You should not have to pay for any of that care.
Okay. I did see that, and thank you. I think they should be waived.
Do you have any other questions for us today? Anything that's still bothering you or anything else we could do for you?
No, I think, Catherine, that's all good for now. Thank you.
Okay. Well, I'll continue to be available for you if you think of anything in the future, and we can connect you again with Dr. Simpson if you need. But if there's anything else we can do, we are here and we want to support you. And we really, again, are so sorry that this happened.
Thank you.
And thank you, Mr. Stanfield. Hope you take care.
Thank you.
Hello, this is Catherine.
Hi, Catherine. It's Ken Stanfield. We talked a few weeks ago. Do you have a few minutes to chat?
Yes, I do, of course, Mr. Stanfield. My next meeting isn't until 9:30, so I have plenty of time. How are you doing?
I'm doing okay. But, I've been thinking about this whole situation for a while now, and I wanted to get right to the point, to see if there's a way for me not just to have my bills waived or whatever, but to also get financial compensation for what I've been through. Because it really was awful. And, also, I don't really know what the implication or the consequences, whatever you want to say, are going to be to my kidneys in the future. This caused me a lot of problems. I was hospitalized for a few days, and I just don't know if this is going to impact how my kidneys are going to function in the long run. I know they're going to continue to test in the future to make sure everything's okay as a result of this experience, but it's just something that we just don't know yet.
Yeah, of course. I understand what you're saying. I'm glad you called to let me know what you've been thinking.
Yeah, I've been going back and forth on it, so I just thought I would ask. I know you explained to me a lot about the hospital billing practice, and it seems like I should just get something in addition for what I've been through. It just shouldn't have happened. I think I suffered a lot. It was a lot of pain for a few days, and my wife was also extremely anxious about the whole thing. Like I said, I don't want this to happen to someone else, but I also have to make sure that if something happens to me down the road because of this, that's taken into consideration.
Yes, I understand. I think so. We do have a process for this. I think the best step really is for me to connect you with our malpractice insurer. They handle all kinds of financial compensation for events that happen, and they're called CRICO, CRICO. And what we usually do is connect you with them to, and they'll review your case and discuss with you some of the harm that has happened and how you feel like it's impacted your life. Does that sound okay to get that process started?
Yeah, no, I just thought the hospital would be taking charge of this. I didn't know there would have to be an outside insurance company dealing with this, but if that's the way it is, that's the way it is.
Yes, that is the process that we use in our hospital. Not all hospitals are like that, but for us, that's the way that it works. But I'm happy to connect you with them. They'll probably call you in the next week or so once I set that up. They're called claims reps, so they may introduce themselves as that. But if you don't hear from them in the next week or you have any questions in the meantime, please call me and I will help with that.
Okay. All right. Well, thank you. I appreciate it.
Okay. Yep. No problem. Have a great day, Mr. Stanfield.